सामान्यतः वैक्सीन्स के डेवलपमेंट में 8 से 10 साल लगते हैं। अभी तक के इतिहास में जिन वैक्सीन्स को कहा जाता था कि ये तुरंत बन गए, वो तुरंत भी 4 साल में बनते थे। यानी फ्रॉम R&D टू प्री क्लिनिकल ट्रायल्स टू phase 1, phase 2, phase 3 used to take 4 years, and everyone globally used to hail that success by saying that such a quick rollout of vaccine. But given the size and the impact of the pandemic, we are trying to crash that timeline of 8 to 10 years, or at best 4 years, into 16 months, 18 months. And not only one, but multiple vaccine players within the country and outside the country are trying to bring about their vaccines within this compressed timeline. So when you have this context, then there is a potentiality that commercial interests would dictate certain strategic actions on part of commercial entities. Governments of the day have nothing to do with it. However, the responsibility of the government is that we must educate the people, because it is the people who would eventually receive the vaccine. So the responsibility of the union government and the state government is to ensure that people are made aware about the safety aspects of vaccine, about the effectiveness of vaccine, and all disinformation is countered promptly. When I say this, I must also tell you that this is not only the sole responsibility of union government and state government, this is also the responsibility of the media, of NGOs, of vaccine manufacturers. They must collectively come together and try to counter misinformation. They must collectively educate people about the safety aspects of vaccine and about the effectiveness aspect of vaccines.
I think you've answered it.
13.
So there are still several restrictions in place for this disease, and yesterday you issued a new advisory. But, government, police is using methods like tear gas and water cannons at a time when COVID is still on the prowl. People are coughing and sneezing and tears in their eyes, and water cannon, it's a droplet transmission. I mean, you know that better than all of us. So what is the Health Ministry's position on this, sir?
Law and order decisions are taken by the local authorities. Therefore, I would not want to comment on this.